Marlborough Hospital fared pretty well in comparison to other community hospitals. Fiscal 2013 ended with a profit, and this year they hope to keep the momentum going.
In 2013, the hospital had a lot of volume growth throughout the area, and that generated a little bit more income than it had planned in its budget. But with any given good year, you end up with a couple of years that are bad. It's a balance throughout the organization, but still the profit margins were well under 2%, which if you look at any of the data out there, hospitals really need to be generating between 3 to 4% to be really viable in the long-term future of replacement of facilities, equipment, upgrading staff, increasing services, etc.
Turning a profit as a community hospital is not always easy. 2014 is turning out to be a little more difficult than last.
With just a little bit of volume growth, you can generate a little bit of income. Unfortunately, times change. This year we're experiencing a little bit of a more difficult year. We're running about $1.7 million under budget, which was a break-even budget, so we've lost about $1.7 million. However, the last couple of months we've gotten a little bit better and we're closing the gap. Hopefully we'll get there by the end of the year.
The hospital is doing everything they can to maintain services and maintain a profit.
In January, we did a small reduction in force. We reduced about 10 full-time equivalents and then reduced the hours on about 27 other people. That's going to save the hospital operating expenses anywhere between $2 to $2.5 million. On top of that, we've reduced our management team by about a third, taken out the overhead structure, shifting that money back to the frontline caregivers and working on making sure we provide a really good high-quality product, which is how you generate more people coming to your hospital.
Although some cuts have been made, it will not affect the high-quality care patients receive. Over the last 2 months, the hospital has turned a profit, and hopefully this will be the trend for the rest of the year.